Hi, congratulations on your pregnancy. The right kind of exercise program done consistently throughout your entire pregnancy has so many incredible health benefits for both you and your baby. Now I know exercising during pregnancy is not easy. Seems like every single day pregnancy is throwing new curveballs your way, and it makes it very tempting to skip exercise. I know personally, I'm pregnant myself, so I know how challenging it can be, but I also know how incredibly beneficial and rewarding it is. So I'm here to tell you, you are not alone, have no fear, we are here to help. I want to give you some very quick exercises you can do to target vulnerable areas during your pregnancy. First, we're going to start out, I want your hands straight out in front of you, arms straight out, so we're going to keep our arms straight. You're going to squeeze the shoulder blades together, then kind of roll your shoulders down and relax forward. So squeeze back, roll them down and forward. And when you squeeze, I want you to really squeeze those muscles so you activate those muscles in your upper back. Now I want you to do 10 of these. So after you've finished your 10 scapular retraction exercises, I want you to come down to the floor on your knees. So I want your wrists are going to be right below your shoulders, and then you're going to bring the knees back so that you have a straight line from your head all the way down to your knees. Core is tight. Hold in this position for 1, 2, 3. Drop the feet, lift up into extended plank. Hold for 1, 2, 3. Drop down and hold. 2, 3. Raise up and hold. 2, 3. I want you to repeat that, so I want you to do 20 total if you can. If that's too difficult for you, start. So you finished your core, you finished working your core, it should feel really strong right now. Then we're going to move on to a squat. Squatting is great exercise during pregnancy, and since in our culture we do so much sitting, throughout your pregnancy it helps a lot to practice squatting so that your pelvis is able to open, your hips are able to widen, to help that baby come down, also strengthening your lower body. So what we're going to do is we're going to do a squat hold for 1 minute. Sounds hard, and it might be hard initially, so if 1 minute is too hard for you, you can start with 30 seconds. So what I want you to do is I want you to come wide, feet wide apart, toes pointed out, and ideally you can do it with no support. So ideally you come all the way down. If you want to rest your hands, you can. If you want your hands up here, however you want, you're going to rest in this position for 1 minute. Now if this is too challenging for you, position yourself in front of a couch, a sturdy couch, and you can hold on so you can put some weight on that couch. Or if you have a door frame close to you that's closed and is also secure, you can grab onto that door handle and hold on to that. It also works if you put someone in a chair right in front of you and hold onto that back of that chair. As long as it's very stable so you can pull your weight and you won't fall down. You're going to hold that for 1 minute. Like I said, if that's too challenging, go down to 30 seconds and work your way up to 1 minute. So you've just finished your squat. Your whole body probably should feel really energized and really strong. And now we're going to stretch out that lower back. So I know during pregnancy, a lot of women suffer from lower back pain. So a simple trick that I like to do is use a tennis ball. If you have a lacrosse ball, you could also use that. That's not as common, so that's why I usually recommend tennis ball. You're going to go up to a wall, take the tennis ball, you're going to put it on one side of your spine. So don't put it actually on your spine. Put it to the side of your spine on your lower back. Come up against the wall. And then you're just going to kind of roll your body down and up. And then to the side. Try to find those spots on your back that are a little bit sensitive. This should feel good, not painful. And then you'll switch the ball to the other side of your spine and just roll down and up, side to side. So you can keep repositioning the ball. If you've got some pain in your mid-back, you can do it up there. Even in your upper back, you can do that. You can do it for as long as you want until you find some relief in that lower back.